Mr. Speaker, honorable members, this time last year, I provided this House with an update on COVID-19 public health guidance. At that time, we had about 270 confirmed positive cases, and 1 or 2 people were in hospital. And that was the beginning of our second wave. As I speak to you today, with our fourth wave dwindling, we have had 5,730 confirmed cases of COVID-19, more than 300 hospitalizations, and sadly 106 COVID-19 related deaths in the community. While the fourth wave exacted a toll on all of us, we in the Ministry of Health are convinced it would have been worse if not for the level of vaccination in our community. Vaccines do work. Our island data proves this. Mr. Speaker, the next step for all of us in Bermuda is to learn how to live with COVID-19. The pandemic is not over, so we must continue to follow public health guidelines to keep ourselves, our families, and our friends safe. As I've stated in this House before, and this is well worth repeating, success in dealing with COVID-19 requires a community effort. It is a community effort because this is one of the few situations where an individual's decision to adhere to public health measures or not impacts all of us. In this pandemic, individual choices can and do have island-wide consequences. In keeping with the decrease in levels of community transmission of the virus that causes COVID-19, the government is making the following changes to the Public Health COVID-19 Emergency Powers Phased Reopening Regulations 2021. The size of large groups will now increase from 30 to 50, and this includes weddings and funerals, as well as island boats in respect of the use of safekeeping. In restaurants, members clubs, and bars, tables no longer need to be spaced 6 feet apart. However, for the time being, these establishments will still be restricted to seated service only. With respect to recreational boating, raft-ups are permitted once again. And students enrolled in a school testing program will be able to use a student 7-day pass issued after a negative test result to enable them to dine indoors with parents or guardians who have safe keys, and this also will apply to their ability to attend youth sporting and recreational activities that also require a safe key. Mr. Speaker, having a school testing program in Bermuda's public and private schools has provided a great opportunity for flexibility when it comes to dining. It applies to students that are 11 years of age and under. For young children who are 4 years of age and under, they will be able to dine indoors at a restaurant as long as their parent or guardian has a safe key. We will be working with the schools to implement the student 7-day pass as early as next week. Additional public health guidance will be amended to state that remote working is no longer strongly recommended. Offices can be opened with proper public health measures in place. Also, movie theaters, galleries, museums are to be allowed, providing physical distancing of 3 feet with masks being worn at all times indoors. The legislation and guidance changes will take effect, Mr. Speaker, from Monday, the 29th of November. Mr. Speaker, I cannot overemphasize the importance of continuing with good public health measures. Wear your mask, wash your hands, and maintain a physical distance of 6 feet from others in crowded indoor and outdoor settings, and particularly if you do not know the vaccination status of the people you are with. Again, to repeat myself, this is not the same as choosing not to wear a helmet or choosing not to use your seatbelt, where the person you are most likely to harm is yourself. Failure to follow public health measures has a far more significant impact as the virus spreads quickly throughout our island home, affecting families, schools, businesses, and more. Mr. Speaker, in addition to assessing and making changes to the emergency power regulation, the government is reviewing the island's travel protocols as well. Taking into consideration vaccination levels within countries where the majority of our travelers are coming from, the vaccination levels here in Bermuda, as well, we are looking at amending our requirements to ensure we are competitive. We will be changing the pre-arrival test requirements to accept antigen testing, which are less expensive and easier for travelers to Bermuda to acquire, as well as the PCR test. We are also reviewing the follow-up testing once on island. The changes are aimed at allowing vaccinated visitors to begin enjoying Bermuda quickly without an extended period of quarantine upon arrival. Finally, Mr. Speaker, we are making adjustments to enable residents who travel abroad for less than 72 hours to use their pre-departure test that's obtained in Bermuda as their pre-arrival test upon their return, and this will facilitate quick trips overseas. These changes will require amendments to the Quarantine COVID-19 No. 3 Order 2020 and will be finalized shortly. Mr. Speaker, visitors to the island support our hotels, our restaurants, our bars, and our taxis. They participate in a variety of experiences and visit the diverse attractions the island has to offer. They rent mini cars and mopeds and in general provide an invaluable boost to our local economy. In short, visitors support jobs. As we put in place protocols and policies which will support our economic recovery, it is only natural to consider our border controls and travel testing regime. Mr. Speaker, the ministry has learned a lot about this particular virus and how to cope in a pandemic over the past almost 2 years. The learning curve was steep, and the impacts of COVID-19 on the island and the world were unprecedented in our lifetime. As Christmas gets closer, I would like to take this opportunity to provide public health advice on how to manage as we live with COVID-19 and learn to live with it we must. The government has worked to strike a balance between risk mitigation and the economic impact of taking precautions. With 70% of the total population fully vaccinated and 79% of the eligible population vaccinated, the emphasis shifts to economic recovery. Mr. Speaker and honorable members, you will be aware that one of the most important steps an individual can take to stop the spread is to simply wear a mask, and that remains, and it applies whether or not you are vaccinated. Masks should be worn by workers at all workplace premises, people using public transportation or taxis, any person visiting an indoor establishment such as a grocery store, a shop, a bank, an office, etc., unless otherwise allowed by specific guidance such as that which would apply in bars, restaurants, and gyms, and in crowded outdoor settings where other persons are present and a 6 feet distance cannot be maintained. Also, Mr. Speaker, as we attend Christmas parties in the coming weeks, please be aware that social mixing is identified through contact tracing investigations as a primary means by which COVID-19 transmission occurs. Social mixing can lead to a less robust adherence to public health protocols, so I strongly encourage everyone to be careful and responsible. Mr. Speaker, above all, vaccination is key to living with COVID-19. It reduces the severity of COVID-19 if you get infected, and it reduces hospitalizations as well as deaths. As reported yesterday, Mr. Speaker, the booster vaccine is now available to anyone 18 years of age or older who has had their second COVID vaccination dose a minimum of 6 months ago. You can book an appointment on gov.bm by selecting Book a Booster Vaccine Appointment. Alternatively, individuals can call the vaccine hotline at 444-2498, selecting option 2, or email vaccines@gov.bm. For those who are 65 and older, they can walk into the Pier 6 Vaccination Center Monday to Friday to get their booster. Mr. Speaker, in closing, I would like to say this government is very aware of just how difficult it is to effect economic recovery while still in the midst of a global pandemic. At this stage, it is critically important for personal responsibility to come to the forefront. Wear a mask, practice good hand hygiene, keep physical distance from others, particularly in indoor settings and crowded outdoor settings. Download the WeHealth app and avoid the 3 C's of crowded places, closed spaces, and close contact settings. Mr. Speaker, we have worked hard and worked together to reach this point in the pandemic. Our continued commitment to robust public health protocols is critical, and I want to thank the entire Bermuda community for all of their efforts. Thank you, Mr. Speaker.